Welcome to ISPEC Talks. I'm thrilled to be joined today by Dr. Noah Ivers, a family physician and health services researcher whose work has shaped how we think about audit and feedback in clinical practice. Noah is the lead author of the recently published Cochrane Review, Audit and Feedback Effects on Professional Practice, which took nearly 10 years or more than 10 years, you'll tell us, I don't know, to complete and involves an analysis of 292 studies. We'll begin by hearing a bit about the findings, but what we're really excited to dive into is the story behind the science, perseverance, academic grit, and what it takes to see a project of this scale from start to finish. So first, Noah, tell us a little bit about what audit and feedback is and a brief summary of the review.
Okay, sure. Maybe I could take a step back and say who I am a little bit more first.
Okay.
And then why this topic is interesting, and then what we found. Is that
Great?
okay? Great. So, because I know you know me, but if anybody other than my mom is listening in, they don't know me.
Anyone who's heard me ever talk about implementation science knows who you are, but okay.
Oh, okay. Okay, got it. So anyways, I'm a family doc in Toronto, and I see patients a couple days a week, and the other, whatever is left, I drive my kids around to their sports. And then whatever's after that, I run a research program in implementation science. I have a PhD in clinical epidemiology. So officially my PhD is quite quant heavy, but throughout my PhD and in the time after, sort of had the amazing opportunity to work really, really closely with Jeremy Grimshaw, who I assume your listeners will know who that is. And Jeremy and I are actually about to go have lunch when we're done talking here. So he continues to be my mentor, and that, makes me a very lucky person. I think the point being, despite my PhD being very quant oriented, I think my actual training, my real training, was very behavioral science oriented, and thinking about especially how we understand and hopefully improve the behaviors of clinicians. Me being a family doc, I'm especially interested in how family docs or primary care clinicians think and how they behave, and how we can help them to do best for their patients, but thinking more broadly across healthcare as well. I spend an inordinate amount of time thinking about how we might change clinicians' behavior. And I think that measuring it is a really good start. So hence the idea of audit and feedback. I'll just take one more further step back. Before med school, I was actually in business school. And I didn't know that about me. So I am a business school flunk out. I was sitting in business school, and there was some debate about whether Merck should market a medication that they didn't think they could make money for. It was a case-based kind of thing. And all the folks around me were like, well, if you can't make money on it, you got to drop the product. And I was feeling the soul getting sucked out of me, and I left to go to med school. So that was really a formative moment in my life. But the bits of medicine, of business school that I did before medicine kind of stayed with me. And some of those bits included the concepts related to like performance management and measurement, and trying to optimize how we all act as workers. I think of my job as a family doc as more than just a worker, but it would be nice to optimize my practice.
Well, it's you said we need to start with measurements, and Peter Drucker, right? The management leadership guru, said you can't manage what you can't measure.
It's so really, really hard.
Did impact you.
Yeah, very much so. That's exactly my point. It's really hard to manage what you don't measure. Sometimes we only manage what we can measure, and that's probably not ideal either. But we we do tend to focus on numbers. And so as I was heading out into med school, I thought, like, how do we know, how will I know as a family doc how well I'm doing? I constantly worry that I'm not, doing the best I might want to do. And so I would like to be measured in a nice way. Hopefully it shows that I'm doing well, and hopefully where I'm not doing well, it's like constructive and helpful and not mean. And that in a nutshell is where like my obsession with what we call audit and feedback comes from. Probably like a sense of like personal uncertainty in my own practice. And this background in business before medicine. So that's the background. That's the context. Now, the review. The review that just came out is an update of a Cochrane review that we actually published over a decade ago. In 2012, we published a version of this Cochrane review, and I worked on it as one piece of my PhD thesis. It at that time had 140 trials included in it, but not all of those trials made it into the meta-analysis. And the meta-analysis that we did at that time was quite rudimentary. Methods for synthesis have advanced a lot, and how we think about doing the stats in meta-analyses have advanced a lot, and things like that over the last, career's worth of time. So when we went to start working on the update, after I took a breather about 11 years ago, we had some ideas about how we could improve things. I'll skip ahead because we'll talk about that journey, but I'll let you know what the bottom line basically. Basically, the bottom line is when you measure healthcare professionals' practice and give those measures back to them, when you do audit and feedback, it tends to help. That's that's the take-home point. It tends to help them focus on these things that you're measuring and do a little bit better on those things. And then the next take-home point is how you go about measuring it and giving that information back really, really matters. That is to say, how much of a benefit you get out of this process depends on how you do it. So if you successfully focus their attention on some high priority actions, if you compare their performance with some sort of achievable target, and especially if you compare to top performing peers, and especially if you involve some sort of trusted local champion in that process, you tend to get better results. And that assumes that when the recipient gets this information, so you give me some data that says I'm not doing so well in a particular area and it's from a trusted source and I engage with it, it assumes that I actually know what to do to score higher the next time, that it's in my power. And so, if you take the opposite situation, your kids are bigger than this now. My kids are still in grade school. And, if they get, God forbid, they get like a C or a D on and there's no information from the teacher about how we can do better next time or what resources might be available to us to help our kid do better next time. It's just this big, ugly letter D, or F. Then we're all crying and we want to quit. And the last thing we want to do is give data back to clinicians and make them stop working. This should be a motivational thing, not a demotivational thing. And we can imagine using that like report card metaphor or analogy or comparison, how it could go wrong if we don't do it right. How's that for a quick summary of what's in the review? Now, the review is 450 plus pages. Please don't read it all.
Oh, I've read every word, of course.
No. But like the first few pages kind of get to the main point right away at the start. And so if you do go to Cochrane and you grab this review, you can, please don't print the whole thing. We need to keep our trees and so on.
Okay. So I want to speak, first of all, thank you to your contribution to implementation science, because we know how hard it is to change behavior. And this is a relatively simple intervention that shouldn't require huge monetary investments to work. So it's exciting. Um, but I want to talk to more because we have students, really, a lot of students that listen to this, and I want to talk more about the perseverance, the grit, oh my God, you said 11 years and I thought it was 10. Meaning, were there moments where you were just like, I'm done, I'm giving up, my patients need me more, my children need to be driven to their sports, and enough.
Totally. Yes. I literally have children like that are like big now that didn't exist when we were starting this review. So yeah, I did put it down for certain times. There were times when, for instance, we went to try to get grant funding for it, and it is particularly hard to win a grant for an update of a review. You know, the reviewers are like, well, the prior one's already been cited for a few thousand times. It exists. It's good. Like, what are you doing? Clearly, that's my bad. I didn't make the argument strong enough that we needed to update. But you know, we went through 2 cycles of grant funding that we lost, and this was demoralizing. Let me remind all the students out there, if you don't lose grants, you're not writing enough grants. So this is part of the job, but it does hurt, and it does knock you back. And the other thing that happened was turnover. Like, I don't have the same people on my team now that I did then. You know, people move on in their life. They have kids, as I did. They find other work opportunities. They get sick, as I did at a certain point through this, you know, a few times. And but throughout these sort of setbacks, there was always this sense that like the literature, the science, kind of needs this foundational piece to cite and build off of. And I don't know if that's like lacking humility or something to say something like that. You know, obviously science would go on without it, but it is really helpful to have a like foundational piece to build off of to drive things forward. And I felt like I really wanted to contribute in that way, in a way that like acted as a new stepping stone that, you know, so that, you know, the next folks could then see a little farther by stepping on that one.
And let's make it clear to the next folks that they shouldn't just do a standard audit and feedback, no audit and feedback, because it's clear that ANF works, right?
Yeah, we're
Audit and
done with that,
feedback.
please.
Yeah, now they could test the nuances, the delivery modes, etc. So just so we're not wasting research dollars, etc.
Yeah. Yeah, that's exactly what one of the main messages of the review is. Like, it's time to ask the next set of questions.
So you mentioned there was a lot of turnover in the team. Was there a core group that stuck with it the whole time, or it was just you?
So I think we may have broken a record for number of authors on the review for Cochrane. It's like 40 something. And what that reflects is I have some friends sort of around the world who I continued to nag on and off for a decade and say, hey, can you help me with this now? Oh, is there anybody in your team that can help me with this now? This is the stage we're at now. Can anybody on your team pitch in? And at different times, different people were able to pitch in. So for instance, if I had a grant for something else and one of my team members could maybe find some of their time to pitch in. Likewise, you know, one of my colleagues in the UK or in Australia at different times through the decade of work found a little piece of their time or their team's time to contribute. So there was always change, but there were some core scientist colleagues that were along for the ride the whole way. And I'm so, so grateful for their help. And I really look forward to working with them to like disseminate and promote the review now. And maybe we'll talk about that towards the end about that.
Yeah. So if you could go back 11 years, what advice would you give yourself?
Oh man. So one of the things that I hate is I have like a thing about being the rate limiting step. Like it's okay if you send it to the statistician and they have a queue. And I feel okay knowing that I got my bit done, now I'll wait for their bit. But I have a real obsession with not being the cause of the delay. And so I think, if I go back 11 years, I think what I would have started with a more fulsome, detailed, like project management chart. Like, what's it actually going to take person hours to do the work that we're planning to do? And, if I had planned that out in more like gruesome detail up front, then I think I might have been able to ask more realistic favors and also planned myself for things that oh, well, if I block a bunch of time here and a bunch of time there, I could have, rather than delegated, done some of that myself and so on. So yeah, I think it would have been a really detailed project plan up front. And of course there's surprises, but I think I kind of just
That's where the business school training could have
sort of
come
jump in.
in. Yeah, but that's where your business school training could have helped you.
You'd think, yeah.
Yeah.
Maybe
Well,
I
you
shouldn't
didn't
have
finish
dropped out.
business school, so that's why.
Yes, I shouldn't have dropped out.
I'm an MBA grad, so I'm a big business school advocate.
Yeah, there's
Um,
great stuff. We should be having more MBA and implementation science collaborations. I really think like there's operation science and management science. Like we don't use a lot of that in healthcare, and we should, for instance.
well, that's a great plug for a project that Heather and I are wrapping up. Heather Cocoon for the listeners, another amazing colleague from Canada, on what can we learn from marketing from the business world for implementation science.
Love
So,
it.
yeah, spoiler, that'll hopefully come out sometime soon. Okay, we're over our 15 minutes, so I'm going to ask you a final question. Looking back, how does it feel to see it published, and what's next on your journey?
It's funny, like I was really happy when it came out. Really happy. I sent some like emails with lots of exclamation marks to friends and
Yes,
whatnot.
I got a WhatsApp like that.
Um, uh, but now I kind of want to move on. Like, what's next? I'm ready. So we want to promote and disseminate it. One of the ways we're doing that is we're planning a series of webinars for folks interested in audit and feedback. We have something called the AF Meta Lab. So this is a group of scientists and policymakers interested in audit and feedback, in using it in healthcare settings and also advancing the science of it and trying to work together to do that. Those that want to get on our mailing list, AFMETALAB, AF Metalab at wchospital.ca. Shoot us an email. We will let you know about our upcoming webinar that goes into some detail about the review. We are planning a conference as well in the fall, and that's going to be held by my colleagues in Houston. So if anybody wants a trip down to the Southwest US, things are totally crazy in the US right now, but our scientists really need us to stand with them. So it's a great time from a science perspective, from my perspective, to go, support our scientific colleagues in the States, because things are topsy-turvy there. That's November 6th and 7th. And you can get information again, just email me. And so, yeah, we're building on it by bringing the community together and trying to decide, for instance, at that conference, what's next.
Amazing. Okay. Well, Noah, thank you so much for your time. Thank you so much for your contribution to science. And let's hope people around the world implement ANF, because I know it's big in North America, and I speak to a lot of international scientists, and they're like, oh yeah, of course we do that, and they don't. So I think hopefully this will help push the agenda along in terms of providing quality care to every patient. So thank you very much.
Thank you.